Now, in order to understand how to fix healthcare, we have to understand what healthcare exactly is and what its purpose is, right? So healthcare is essentially services that doctors, nurses, PAs, therapists, healthcare professionals provide to people, to patients, to help them with disease and illness and health-related problems. And so the thing is with healthcare is that these services can be very expensive for valid reasons. And so because health services are unique in that they're not like other types of services like going to the cafe or going to the restaurant where we can afford those costs up front, these healthcare services can be extremely expensive. And because of the incredible expense, that's why we have health insurance. And so health insurance allows everyone in the nation, a huge population, to come together and pool their money together. And right, so we pay this premium to the health insurance company on a monthly basis. And that company takes our money, puts it in a pool, and then gives it out to people when serious health problems arise, like if we have to go to the hospital, have a serious operation, and for these health-related problems. And so this premium is something that's affordable to us on a monthly basis, even though it continues to become more and more out of hand. And honestly, it's not that affordable. And that's the problem that everyone's trying to solve, is how do we bring that cost down? And so the way most politicians and health authorities tell us they're going to solve this problem is through decreasing the costs of these services, through decreasing the cost of drugs, having more transparency between hospitals and health insurance and these payments. And although there is a lot of that that's true and that probably can be fixed and corrected, if we go about it this way, it's never going to fix the problem, and things are only going to continue to get worse and worse. And for many of us, that may sound odd for me to tell you that that's actually not going to solve the problem, because that's what everyone talks about. It's what every single politician talks about. We're gonna reduce drug prices, hospital visits, there needs to be more transparency, etc., etc. But what if we could get more at the root of the problem? What if I told you that these diseases can actually be prevented in the first place? And if these diseases can be prevented in the first place, well then we don't need as many healthcare services. And if we don't need as many healthcare services, then we don't need to keep on paying these high premiums to go into this large pool, when then the health insurance company has to keep on paying these expensive costs. And so if we could actually stop disease before it happens, we could actually make health insurance extremely affordable and a lot more effective. Now, you may be saying, well, that's crazy, Jesse, that's impossible. Sickness is inevitable. We need medications, we need procedures, we need doctors and hospitals. And to your point, yes, at times we do need medicines and doctors and procedures, but not nearly to the extent that we're using it right now. Right now, it is absolutely outrageous the amount of sickness that occurs in our country. And the truth is that most of us could actually live very long and healthy lives without ever having to utilize the medical system. And if we do have to utilize the medical system, well then it'd just be for little things to help us out along the way, things that wouldn't be that expensive. So let me actually show you some numbers and some proof backing up what I have to say, because I understand this sounds a bit ridiculous. So right now I'm on the CDC website for chronic disease. Now, if you're not familiar with the types of diseases that go on in our country, the main reason why we use doctors and hospitals is for chronic diseases. Now, these diseases include type 2 diabetes, obesity, heart disease, cancers, etc., right? All the diseases that we're really familiar with. But the truth is that the majority of these diseases don't even have to exist. They actually stem from our lifestyle and what we do. And don't just take my word for it. Look at the CDC website. Health and economic costs of chronic diseases. 90% of the nation's 4.1 trillion in annual healthcare expenditures are for people with chronic and mental health conditions. Chronic diseases have significant health and economic costs in the United States. Interventions to prevent and manage these diseases have significant health and economic benefits, right? So 90% of our healthcare costs are due to chronic, preventable diseases. So let's scroll down. Heart disease and stroke are one of these chronic diseases. Now, I'm going to tell you the majority of heart disease can be prevented. High blood pressure, heart attacks, strokes doesn't even have to exist. And you may say I'm crazy, but let me show you another source. The WHO, the World Health Organization, says the good news, however, is that 80% of premature heart attacks and strokes are preventable. The American Heart Association also says this number. Healthy diet, regular physical activity, and not using tobacco products are the keys to prevention. So what are we doing, right? We're paying for all these services, yet we're not even addressing the underlying cause, and that it never even has to exist in the first place. So let's go to another type of disease that most of our health expenditures are spent on, and that is type 2 diabetes. And so let's look at the Harvard website and what they say. The good news is that prediabetes and type 2 diabetes are largely preventable. About 9 in 10 cases in the United States can be avoided by making lifestyle changes. So again, more proof that most of these diseases do not even have to exist. And so just to follow up with one more type of disease that most of us would think is inevitable, cancer, well, you'd be shocked to learn that a large proportion of cancer is actually preventable with healthy behaviors. And so I'm on the CDC website again. Being overweight or having obesity are linked with a higher risk of getting 13 types of cancers. These cancers make up 40% of all cancers diagnosed in the United States each year. So essentially understanding that obesity is by far and wide preventable. And so we could prevent about 40% of cancer by living healthy and living at a healthy weight. To summarize and to help you understand, the majority of our health problems don't even have to exist. Physical fitness, nutrition, sleep, mindset, our behaviors have a much greater impact on our health than medications, vaccines, procedures will ever have. And so my hope with this video is to help us realize that we've been addressing health insurance, healthcare wrong this entire time. We've been focusing on the symptoms and not the root cause. So instead, we need to pressure our government to not look to medications, vaccines as the cure, and instead look to incentivizing food, organic farming, encouraging physical fitness, removing harmful chemicals, preservatives, additives from our environment and therefore our food. And so that is the conversation that we need to be having. This is the only way to health. There is no other way. But the good news is that we don't have to wait for the government to fix our problems, because the bigger solution lies within us. We can make the choice at our dinner table. We can make the choice at the grocery store. We can make the choice to get up and exercise every single day and change our health outcomes. We don't need anyone to change or do anything for us. We hold the power, and we must understand that. So if we ever want to fix healthcare, change the direction of health in our nation, we have to understand that health depends on us and only us, and we have the power to change. So let's start getting truly healthy. Let's start making true change. So share this video, subscribe to my channel, like it, comment below. Let's continue the discussion, let's continue the conversation, and let's make America the healthiest nation and the leader in health and healthcare.